Good afternoon, everybody. This afternoon, we're going to be presenting an action research project about implementing the ECD service package of the national policy in Nkomazi, and it was known as Leave No Young Child Behind. Next slide. So Nkomazi is up in Mpumalanga, in that little part of Mpumalanga which borders on the Kruger National Park and Swaziland. And this project came to be known by the people in it as one that would ensure that the policy comes alive. Next slide. So the Early Childhood Development Diagnostic Review emphasized the need for a large-scale coordinated intervention for young children if it was going to work. And our National Development Plan and the National Integrated ECD Policy both talk about development partners, non-profits, and business working together to realize the vision for children. And working together has a number of levels, from networking through to collaboration and contracting. And by the time you get, they're each more intense than the other. And by the time you get to collaboration, you are actually improving the capacity of other partners to obtain a common purpose. Next slide, please. So collaboration is widely written up as and recognized as allowing for children and families to access services in a more efficient way. There are savings for service deliverers. Working together provides the kind of energy, impetus, and a multiplier effect, which gets generally a lot more buy-in on the importance of ECD, which then incentivizes investment and stimulates demand for the services by children and families. But there isn't a single model for delivering integrated ECD. Sometimes it's better to have a targeted, well-coordinated, cross-sectoral thing than a formal administrative structure. And we have very, very few examples of effective models in South Africa. So what do we know about the evidence base for collaboration? One of the things that's important is to bring non-state services within regulatory systems, but promote integration by including your non-state actors as well as your key government officials. Other factors include that help would be if there's high-level political endorsement, and there is in South Africa with the NDP and the national policy. Having some sort of an institutional anchor to engage different sectors and overcome turf issues. Engaging local government to ensure ownership and sustainability. Involving a lot of different stakeholders. A participatory approach will encourage buy-in. And finally, the really important thing is having sufficient funding and time to support effective implementation. So the next slide, yes. So one of the things that has been shown in a number of countries, and particularly in low and middle income contexts, is that public-private partnerships can expand services by leveraging resources and expertise. So often there's funding, implementation support, staff training, curriculum and materials, and technical assistance. And all of these are seen in this case study. So I'm now handing over to Jabu, who spearheaded the case.
Thank you very much, Linda. So I will just focus on the case study, of this research that we did in this initiative, the Leave No Young Child Behind. So the overarching objective of this initiative is to see a significant improvement in the well-being of young children from conception to school-going age in the two areas where this project is currently happening in Nkomazi. And how do we do this? Through community mobilization and universal access to a comprehensive package of quality services to meet young children's development rights and needs in line with the National Integrated ECD Policy. And the components of the initiative include maternal and child health, which we do in partnership with the Department of Health. District stimulation for early learning, we do with the local early learning NPOs in the community. Parental and caregiver support, which we do with the Department of Social Development. Child protection, infrastructure and services, and key to all this is collaboration and partnerships. So how the structure of this initiative, includes many role players from different sectors of the community. We have a steering committee committee that we work with at provincial level. That is basically the decision makers of the various departments tasked with implementing ECD in the communities. These include the Department of Social Development, Health, and Department of Education, of course, with the RCL's Dumo Foundation. And then we have technical committees that meet at the district and monthly. And these technical committees have participants from various stakeholders over and above the 3 government departments I mentioned earlier on. They include the Department of Home Affairs, they include SASA, they include NDA, COGTA, CWP municipality, the environmental health practitioners, and the Dumo Foundation. And someone might ask why Home Affairs? Like Linda mentioned earlier on, the Nkomazi community is one of those communities that have porous borders. So we are bordering with Mozambique and Swaziland. And then we, of course, have implementation support on the ground at district level, but by various stakeholders, including, of course, the Dumo Foundation, Lima, and many more. And key to all of this is communication. So one of the things that we have managed to secure is the use of the local community radio station so that we can be in a position to reach out to parents. And the collaboration process, as highlighted earlier on, so at provincial level, we have an MOU that was signed by the key government stakeholders, including RCL Foods, Dumo Foundation. And the role of the steering committee is, they provide that strategic direction of the initiative, like an implementation plan, a strategic plan, all guided by the M&E framework, to report on development and outcomes. And then at the technical team level, it's also quite inclusive, as I've alluded to earlier on. This technical team, they meet monthly, and the aim of these monthly meetings is where the various stakeholders will come together and report on developments, of the work they are doing in the various communities. For example, SASA will tell us how many children have received children grants. Data Lowfield will tell us about the training they're doing for practitioners and principals. And then, of course, we've got other partners that might not be ECD organizations, but they do provide support, like Lima. Their role is to provide the coordination and stakeholder mobilization at district level or in the communities. And then, of course, we've got other stakeholders that we bring on board to provide expertise, inform program and strategy, and leverage additional sources. So when we're doing this research or evaluation, many data sources were used. For example, we used Live Know Your Child documents, which include reports. We had focus groups that were interviewed, for example, your provincial steering committee and technical committee. And then we had individual interviews with people, working for the various organizations and NGOs. We also had interviews with some of the organizations that came in as other funders. We also interviewed parents and playgroup practitioners. And the baseline and line quality report that we focused on the ECD centers and playgroups as evidence of outcomes. Over to you, Linda.
No, these 2 are for you.
Oh, these are for me.
The next 2, yeah.
Oh, just gosh, now what's Mary going to do? Okay, so how has this worked? The Ligno Young Child Initiative has been a learning for many organizations who are involved in this partnership. And one of the key things that have really come out is that there's a lot of information sharing, because what we found on the ground, even the very stakeholders that have been tasked with ECD, you would find that some of them have had little knowledge on early childhood development. So this platform has been quite useful to all stakeholders. And also there was a better understanding of the national ECD policy. Let me make an example. For example, many of the government departments were not aware that they actually have a role, in implementing ECD. But during, this forum, we were able to share the roles as stipulated in the national ECD policy, and they did acknowledge that it was quite useful because prior they didn't know. And again, this has helped in terms of role clarification, because I remember when we started, other people felt, no, I shouldn't be sitting in this committee. I'm not part of early childhood development, but over time, they realized that they actually have a role. And of course, we had this initiative brought additional human and financial resources. For example, we have stakeholders that were actually not operating in the area, but because there was now this foundation, they came on board. And one organization I can actually mention is the Grow Great campaign. It was not in operation in our area in Mpumalanga, but when they heard about the initiative and how it operates, they also came on board and adding value, all towards improving the lives of young children from conception to school-going age. And there, of course, is some of our partners alluding to the impact, the positive impact that this initiative has done in the area where we work. For example, let me read one from a DSD official who said that we have been able to work together as different stakeholders, and through the initiative, we've been able to expand ECDC service to those poorest areas. And another comment says, I think we now have a culture of sitting and meeting, which make our work easier. If I say home affairs, I know who to talk to, so I don't have to start from scratch all the time. So basically, these initiatives and these committees that have been formed has allowed stakeholders at district level to know who's doing what. So when they need help, they go directly, for example, to that person at Home Affairs who sits in the technical committee. And in that way, we achieve more things quicker. Over to you, Linda, now.
Okay, learning. So what have we learned out of this that could be applied elsewhere, given that the policy requires that every local district should have some kind of a structure to coordinate ECD? I think the first thing that really helped was the explicit commitment, having a policy, but also that there was a memorandum of understanding between the key partners. That memorandum bound them to attending, to giving the time needed, but the resources also came because this partnership was able, through the private sector, to leverage a great deal of extra money. Sitting together and reporting and having management from the Do More Foundation meant that everybody was held to account. Now, one of the big things in the beginning is to build trust between partners and to recognize that there are very different styles between government and the private sector, and to come to decisions jointly. I can't actually see this point at the bottom, I'm afraid. I think it's from my notes here, it's being familiar with the local context, sorry. Mm-hmm. So everybody in the technical committee that actually ran it, as opposed to the provincial oversight, was actually on the ground and they knew what was going on. Next slide, please. Communication was a huge issue. Sharing of data, in fact, and that also links into the M&E, that with built-in M&E and regular feedback, people were able to track their progress, see where the gaps were, see where the gains were, which was very incentivizing. One of the biggest learnings for anybody trying to roll this out on a bigger scale is the need for leadership, nurturing and oversight. In Nkomazi, we had a champion in the company with status in being the company. We also, sorry, can you just go back one? We also had on-the-ground support, and then having a chair of the technical committee who was not a departmental official, so there weren't any turf battles between who was then to be in charge, and whether one department could give instructions to another was very, very useful. Next one. So you can just have a glance at some of these. The resources was very important for rallying and impetus, having extra money. I think time helped. This has been going on now for a good couple of years. There was anxiety in the beginning, but people started to see how working together would help them. And you can just see how that's kind of taken off from there. And again, as we've said before, the role of RCL or Dumo Foundation, who actually had dedicated time to put into this, as well as some resources to coordinate the process and help with gaps in services, was recognized by government officials. Next one. But there were challenges, and I think this is something that everyone needs to bear in mind as well when rolling out. You've got to get buy-in and accountability. Everybody recognizes that government departments are incredibly thinly spread and understaffed. And they were very upfront that without a backbone organization, it would not have been possible to sustain the process. There are unequal power relations. It is a challenge. The private partners must not seem to be taking on government roles. So that has to be negotiated. And one also noted that sometimes there's a lack of fit between organizational cultures. Government has, as a large bureaucracy, takes much longer to do things versus NGOs and business timelines, the issues of communication protocols and budget cycles. So let's just have a look at a couple of comments about the challenges. So quite a number of people spoke about the challenges coming because business didn't understand how government worked. The fact that this is not possible without dedicated project coordination. And in the beginning, there was quite a big effort to get buy-in because people thought it was extra work, extra meetings. And they only came to see over time that by doing this together, it was actually enhancing the work and making it more efficient and less time in the end. So the next steps, next slide, are to try and roll this out and replicate this, first of all, in further wards in Nkomazi. This started in the 2 poorest wards, and also in Worcester in the Western Cape, in Breda River Valley, and in Pongolo in KZN. And each one of those will have a slightly different way of working. But we feel that it's very likely that the same enablers and lessons will prevail. Thank you very much.